How do decibels dB affect speech and hearing? Imagine trying to listen to a whisper across a quiet room or a loud concert. The difference in loudness is measured in decibels, or dB. These numbers tell us how strong a sound is. But how does this affect our ability to hear and speak clearly? That's what we're here to find out. Decibels measure sound intensity. When sounds are low in decibels, like a soft whisper, most people hear them easily. But as the decibel level increases, sounds become louder and can start to impact hearing. For example, normal conversation is around 65 decibels, which most people hear comfortably. But if the sound gets much louder, like at a construction site, which can reach over 100 decibels, hearing can be affected if exposed for a long time. At very low decibel levels, from 0 to 15 decibels, hearing is considered normal. Speech and language usually develop without problems. But when hearing drops slightly, between 16 and 20 decibels, it might be harder to hear faint speech, especially in noisy places. Still, most speech and language skills stay intact. When hearing loss reaches between 21 and 40 decibels, some parts of speech, especially consonants, might be missed. This can make understanding speech harder and may cause speech clarity issues if not treated. If hearing loss becomes moderate, between 41 and 55 decibels, a person might miss half or more of speech sounds. This often delays speech and language development and can change how someone sounds when they speak. Severe hearing loss, from 56 to 70 decibels, can cause almost all speech sounds to be missed without help. This often leads to big delays in learning language and can make speech sound monotone or flat. Loud sounds above 85 decibels, like loud music or machinery, can damage the tiny hair cells inside the inner ear. This damage is permanent and can cause noise-induced hearing loss. When this happens, even if sounds are loud enough to hear, the brain may struggle to tell speech sounds apart. This makes understanding speech more difficult and can affect communication overall. For children, hearing loss caused by loud noise or other issues can interfere with learning language. They might miss parts of speech or have trouble articulating words. This can slow down vocabulary growth and make classroom learning harder. Since much of learning depends on listening, speech delays can lead to academic challenges later on. In speech therapy, early detection of hearing loss is very important. Using hearing aids or other devices can help improve hearing. Making the environment quieter or reducing background noise also helps children and adults hear better. When hearing improves, speech perception gets better, helping with clear speech production and effective communication. To sum up, decibel levels directly influence how well we hear. Mild to severe hearing loss caused by loud sounds or other factors can delay or impair speech and language skills. Protecting hearing from loud noise and providing support when needed is key to keeping communication clear and speech development on track.